Thank you. I'd like to thank all of you for joining us today. I want to first start by acknowledging the loss of a member of our community yesterday. I again want to express my deepest condolences to the family and the loved ones of this individual. I'd like to ask that with respect to the family, we all regard their privacy during what I'm sure is an extremely difficult time. BCHU will not be commenting any further on specifics regarding this case. Since we last spoke on Tuesday, there have been an additional 17 new lab-confirmed cases in Brant. We are expecting to see an increase in number of positives as the backlog of tests have been processed. From March 28th to April 1st, there were also 143 negative tests reported to the health unit. With that said, with community transmission established in Brant, residents need to follow all recommendations and orders, or we will continue to see the rise in cases. On March 30th, the Ministry of Health announced changes for what would constitute a COVID-19 outbreak in a long-term care home. By definition, long-term care homes must consider a single laboratory-confirmed case of COVID-19 in a resident or a staff member as a declared COVID outbreak in the facility. This decision was made to help protect some of the most vulnerable members of our communities. By these new definitions, 2 long-term care facilities meet the criteria in Brant for COVID-19 outbreaks. These facilities include Telfer Retirement Home and St. Joseph's Life Care Center. 1 staff member at each facility has tested positive for COVID-19. Both of these individuals are self-isolating at home. With respect to privacy laws, we won't be disclosing any more information about these 2 cases. To date, no residents have tested positive for COVID-19 at either facility. Tests have been given to staff and residents at these facilities, and we are awaiting the results of those tests. As per the ministry's directive, testing must be conducted for COVID-19 on every symptomatic resident and long-term staff at a long-term care home or retirement facility. There is a low threshold for testing these vulnerable individuals and their healthcare workers, and even minimal symptoms will be tested.
So thank you, Dr. Urbantke. We'll now open it up for questions.
Dr. Urbantke, I know you said you didn't want to release any more information about this area's first death. I just want to know if it's possible to find out whether or not that person was someone who traveled, or if this is a case of community spread.
Sorry, I can't release any more specifics.
Just to follow up on that, this is Susan. A lot of people are kind of comparing the health unit here to what other health units are releasing, and we seem to be getting a lot more information from other health units. So it's a concern to people that they're not getting some of the most basic things. I guess they're wondering, how can telling somebody how somebody caught this virus be an infringement on their privacy?
So we have, in general, been releasing that information, but with the sensitivity of the recent death, at this point we're acting in respect to the family. I can give you some general information, and certainly the other thing is we've had a lower number of cases than other health units to date, and so if we release stats on some, it might make people identifiable. However, as our cases increase, certainly we can look at more robust statistic reporting. Such as in regards to the 17 cases that we've seen over the past few days since Tuesday, 9 are female, 8 are male. Their ages range from under 20 years old into their 60s. 1 is suspected of community spread. There are a few that are still being investigated. and others are either close contacts of confirmed cases or travel related, and all 17 are self-isolating at home.
Do we have a sense of how many people are hospitalized at this point?
There is only one person hospitalized in relation to the Brant County Health Unit.
Dr. Urbantke, can you please tell us when the staff members at the long-term care facilities tested positive?
Those results have come in over the last few days. Off the top of my head, I can't tell you the specific dates.
Were they in self-isolation before around the time they were tested, or before they got their results back?
They were in, as soon as we reported, as soon as they were reported to us, even before they we received their tests, they have been in self-isolation and being followed.
Can you tell us what those facilities are doing now that they've had workers test positive?
So certainly, as I said, there are outbreak procedures that facilities undergo, even under normal respiratory outbreaks. But in addition, there's an enhanced procedures, including isolation, use of PPE, increased screening, increased testing at the facilities, among others.
And can you tell us if they are community spread cases, or if they had traveled or been in contact with somebody who had symptoms?
I don't know those specifics off the top of my head. One is a close contact. One is a close contact of a confirmed case.
Thank you, Dr. Urbantke.
So, Dr. Urbantke, I wonder if you can tell me about Six Nations cases. Six Nations is in Brant County. Why are their cases not counted with our statistics?
So Six Nations actually has its own public health unit, our Sweetcomb Public Health Unit. So they do not fall under our health unit's area jurisdiction. While they are geographically located, they do have their own health unit.
Are their numbers being reported to the Ontario health line information as well as your numbers?
Yes, they would have to report their cases also.
Can you tell us a little bit about the mask and glove situation? We continue to hear from nurses that they are being restricted with equipment that's being used in the hospitals. And this week, we're starting to hear that the CDC is considering a change in what they're telling people about wearing masks, so that we're adjusting, or they're at least looking at the possibility that places like Taiwan have got it right, where everybody wears a mask because we don't know who might be symptomatic and might be spreading the virus unwittingly. What's our mask situation like here in Brantford? And are you going to start telling people that they should be covering their faces when they're out?
So the specifics for PPE would be better, and supply to, say, the frontline healthcare workers would be better directed to the Brant Community Health System. As PPE has been a challenge for the whole province, and that to date, it's no different from elsewhere in the province in Brant County to date, but I can't speak specifics of what the hospital's numbers and supplies are. So that would have to be addressed to the hospital. Sorry, I think you had a second question, a part to the question. Could you just repeat it?
Yes, certainly. I'm asking about the idea that there seems to be a change in the wind about whether people should be wearing masks, whether regular people that are not healthcare workers should wear a mask when they're out, or some kind of bandana, a homemade mask. There's now some thought that we should have been doing this all along. So I'm wondering whether you are going to make an adjustment in your advice to people about wearing masks.
So, as this evolves, more and more evidence is coming in, and we are adjusting recommendations as evidence comes in. Certainly, we need to preserve our PPE supplies for our frontline healthcare workers to ensure that they are able to properly take care of our loved ones and community members throughout this time. As for masks in general, the evidence, so they do help protect. If you're wearing something over the face and you have mild symptoms or just in that pre-symptomatic phase, certainly if you cough or sneeze, it will help contain it. So in that respect, yes, that would be helpful in the general public, but I also am quite cognizant that we need to preserve our PPE for our frontline workers. But we may see recommendations evolve over the next few weeks, and that would not be unexpected as we learn more and more about COVID-19.
I think everybody does understand that the healthcare workers have to come first. I'm wondering, you guys must have a supply of masks and equipment as well. How is your supply doing for the health unit?
We have a small supply because we do not, in general, do frontline, like direct patient care, but we do have some clinical services. So we do have to maintain a small supply for our clinical service people if they should need it. But beyond that, any supplies such as swabs and things like that, we certainly would pass on to clinical healthcare workers.
Do we have any word of new masks coming from the federal government? They've talked about this, but do we have something coming, a shipment perhaps?
I have received no direct information about shipment. From conversations with the hospital, PPE is being very provincially coordinated, and not so. Once again, it would be more the acute care sector that would be better able to answer those questions.
Do we have a list of the number of tests that have been performed each day? And can you tell us, is the number of testings that are being done going up or down? Or what are we seeing as far as people wanting to get tested or asking to be tested?
So once again, the assessment center is run by the hospital, and so specific daily numbers. However, they have provided us weekly with the number of tests, and that is posted on our website. It was last updated on Wednesday, and the number was 665 given to Brant residents. I can't 100% speak to how big the backlog is, but my understanding is we are basically through the backlog now. They certainly ramped up the testing since last weekend, and that is my understanding that the backlog is basically cleared at this point.
Early days, there were complaints that people were going to some of these places or calling the health unit with symptoms but not being able to access testing. Do you think that that's kind of leveled out now? Do we have enough test kits? I know this is, as you say, something more for the hospital to be able to answer, but I'm just wondering, you must get the calls from people saying that they got symptoms as well.
Yes, so certainly the health unit doesn't do the actual testing, but certainly if we identify a person who's called in, that we will refer them over to the assessment center.
So if there's no more questions, I appreciate everybody joining us, and like I've always said, I appreciate you guys getting the message out there. So we'll pick this up again on Tuesday at 3 o'clock. So thanks everyone for joining us.
Ryan.
Hi.
I just wondered if Dr. Urbantke can perhaps give one more message to the community. We're looking at a very bad week probably coming up. What do you want to tell people to try to mitigate this as best as possible?
I just want to reiterate what our messaging has been since day one, that this needs to be taken seriously. People need to obey the recommendations for physical distancing or social distancing. They need to wash their hands. We need to protect our vulnerable populations and help them out as much as possible. It's going to take everyone doing everything in their power to help defeat this.